The NPI is an intelligence-free 10-digit number which is unique for every provider. Say a provider is in Florida or in Texas or in Ohio or in California. Each one would be given one number. All over United States it's just one number, so no two doctors can have the same identifiers. Another thing is like misrepresentation of NPI is fraudulent. That you should understand. A doctor does a service and if he wants to show to the insurance company when he's going to send a claim, he will have to include only his NPI. He is not supposed to use the NPI of others. Here you must remember that we were seeing about one particular condition where we can use is called as incidental billing, which we will all discuss in detail in our next class or in the subsequent classes. Okay. So here NPI should not be misused. Whoever renders a service or if there is a supervising provider, and the claim should contain the relevant NPI, because this is very crucial, which the insurance company would closely monitor. As we saw earlier as a payer ID, same way it would be a HPID, which is nothing but the health plan ID. Again, you should understand the insurance company is one, the payer ID would be one. Within the insurance company, there would be different plans. Say we have Medicare, we have Part A, Part B, Part C, Part D. Same way, the plans can vary. There can be a medical plan, there can be a dental plan, there can be a vision plan. When the patient is actually enrolled in a vision plan, then you need to submit only the I codes. You are not supposed to use the medical codes. When you use the EIN code for a vision plan, automatically the claim will be denied, stating irrelevant or incorrect codes. Because if it's going to be a vision plan, you will have to report only the I codes, as you know, which are there within our medicine section like 92002 or a 92012, depending on whether the patient is new or follow-up. We should know exactly, not all plans will cover all the services. According to the health plan, most of the time when you see, the denial would be actually for it is inconsistent with the payer guidelines. Like coding wise, when you see the medical record, it would be correct. Patient is enrolled in a kind of a plan which does not reimburse such services or which consider such services as cosmetic. Take for instance Botox. You will have to verify the payer policies upfront and then you can render the service. What we would see is like EIN, which is another ID, identifier called as employer identification number. Say you are going to have a group health insurance, and if you want to make use of the group health insurance, you need to include this EIN, which is the employer identification number.